We discuss Nigeria's national statement at the ongoing 79th United Nations General Assembly.
We'll take a look at how we can prevent serious effects to the zoonotic disease called rabies.
And in sport, an audit has been put in play by the Ministry of Sport over the 2024 Olympics.
This and a lot more on this show. This is live from Abuja.
A show that takes you through the event that have shaped the week in Nigeria and across the world, from politics, news, entertainment, and sport. Hello and welcome. I am Ademola Lawrence.
I am Jane Francis Mweze. I
will start with ONGA. The 79th session of the United Nations General Assembly, ONGA, opened on September 10th, 2024, with high-level week taking place to September 20 to 27 in New York.
Nigeria's President Bola Tinubu, represented by Vice President Kashim Shettima, read Nigeria's national statement at the event with a focus on seeking debt forgiveness for not just Nigeria but other developing nations. He urged the multilateral financial institution and global creditors to implement comprehensive debt relief measures to support economic progress in the global south, highlighting that the current global financial architecture places undue pressure on developing nations, hindering their efforts to improve our citizens' welfare. President Tinubu also pressed for reforms in international financial systems, calling for a rules-based, non-discriminatory, open, fair, inclusive, equitable, and transparent multilateral trading system, stressing the importance of recovering illicit financial flows and returning stolen assets to their countries of origin.
According to him, such changes are essential to addressing persistent challenges developing countries face, from poverty to hyperinflation. A little quote from the remarks by President Joe Biden states, "The future will be won by those who unleash the full potential of their people to breathe free, to think freely, to innovate, to educate, to live and love openly without fear."
And also from the Secretary of State, the U.S. Secretary of State, Anthony J. Blinken, he said, "We're here today to build the future in which our citizens, their children, their grandchildren can live in peace and security in a world without nuclear weapons."
Offers us the surest guarantee of global action to address the existential challenges we face. Singularity and nationalism are undermining the aspirations towards a peaceful and collective resolution of such challenges. From last year's summit, and indeed from previous years, we have carried over the numerous challenges of terrorism, armed conflict, inequality, poverty, racial discrimination, human rights abuses, food crisis, hunger, irregular migration, piracy, global pandemics, hyperinflation, nuclear proliferation, grinding debt burden, climate change, and a host of other vexations.
I think it's a major discussion in ONGA there, and if you ask me, I think to a large extent the African leaders, although over the years it's been like a cliche, you know, where they go to ONGA to discuss issues about why the continent need to be given more attention. You know, one of those reasons they are also putting forward is that Africa needs to be on the UN Security Council, be a member of the UN Security Council, and of course that's been a very, very interesting one. And you look at what exactly Africa is talking about in terms of US Security Council. I think it's a very good one, but it's just a cliche over time.
Well, looking at all the things that we have achieved with the UN General Assembly over the years, charters being signed, discussions being opened up. You talk about the SDG, and you look at where Nigeria is from when it started to the year target. I think even before we got to the SDG, there was MDG, and it's not like we met up with the MDG, and now we are at the SDG, where we're looking at what's the healthcare system, what's the improvement we're seeing in the healthcare system. Do we now have basic access to basic healthcare, like people in the village, can they easily access healthcare? You look at the universal basic education, we're wondering, the question is how much free education do people have at the basic education level?
Education is very expensive now, I must tell you.
I'm even talking, now maybe you're looking at university, but we're saying people who are actually, you know, when we talk about the poorest of the poor, and then you say there is a basic education, which is a primary education.
Yes.
So are they going to get education enough, like our parents or our grandparents got in the days when at primary 6 they were able to even teach, you know, other people, because at primary 6 you could apply to be a teacher and all that. So those are the questions. What's the quality of the basic education that we're offering for free to the poorest of the poor without people wanting to go to the private school? I think
I get your points there. And of course, one of the discussions also on that particular scene is the fact that Nigeria is asking for a forgiveness of debt.
So that's the thing, because at the end of the day, what would make more people interested in ONGA, you know, when they say there's a UN General Assembly going on, Nigerians are going to be more interested because they have had actual benefit from the previous years. So right now it just looks like, you know, a couple of bourgeois leaders gathering, gathering and making. So it's always, like the decisions.
It's always been like that for over years. It's just that it's a cliche when they go to the UN General Assembly. They talk, but action, the action plan is the most important. But let's go to the headlines now and tell you that the presidency has stated that President Bola Tinubu will soon reshuffle his cabinet. Bayo Ononuga, special advisor to the president on information and strategy, told State House correspondent on Wednesday that the president has expressed his desire to reshuffle his cabinet and he would do it. The spokesperson also said that the president has asked his minister to actively communicate the milestones and achievements of the administration.
Secretary to the Government of the Federation, Senator George Akume, has unveiled the programs for the 64th Independence Anniversary on the occasion, saying the president has instructed that the ceremony be marked at low-key. On the issue of food scarcity, the SGF said Nigeria has no reason to import food, but for the meantime, the government has made provisions for food importation to cushion the effects current food scarcity in the country, while distribution of farm inputs is ongoing across the nation.
And Vice President Kashif Shettima reads Nigeria's national address at the 79th United Nations General Assembly seeking debt forgiveness for developing nations, including Nigeria. He also met with United Nations Secretary General Antonio Guterres at the UN headquarters in New York, where they discussed issues bordering on pressing issues of regional security, humanitarian relief, and Nigeria's role in international cooperation. Interesting.
The Central Bank of Nigeria, CBN, says its multiple interest rate hikes last year have helped boost Nigeria's confidence in the currency naira. CBN Governor Laimi Kadusu stated this at a press briefing on Tuesday at the end of the 297th meeting of the Monetary Policy Committee, MPC, in Abuja. Cardoso announced the committee's decision to further raise monetary policy rates, which measures interest rates by 50 basis points from 26.75% to 27.25%, to tighten inflation rates, which stands at 32.15%.
The federal government may spend about 236 billion naira monthly to subsidize the premium motor spirit, popularly called petrol, that is imported through the Nigerian National Petroleum Company, and the one that is solely off-taken by NNPC from the Dangote Petroleum Refinery. On Monday, the president and chief executive of Dangote Group, Alhaji Aliko Dangote, and called on the federal government to end fuel subsidies completely. He said the removal will help determine the actual petrol consumption in the country, as his position received backing from the Independent Petroleum Marketers Association of Nigeria and the Center for Promotion of Public Enterprise in Tuesday.
And outside Nigeria, United States President Joe Biden has said that he will provide Ukraine with military aid totaling nearly $8 billion ahead of a meeting with his Ukrainian counterpart, Volodymyr Zelensky. Biden announced the surge in security assistance for Ukraine on Thursday, saying that the aid will be provided in two tranches of $5.5 billion and $2.4 billion. The package included the provision of joint standoff weapon JSOW munitions to enhance Ukraine's long-range strike capabilities.
A Japanese court has ruled that an 88-year-old former boxer was not guilty in a retrial of 1966 quadruple murder. reversing an earlier decision that made him the world's longest-serving death row inmate. Iwa Akamada, acquitted by the Suzuka District Court, makes him the 5th death row convict to be found not guilty in a retrial in post-war Japanese criminal justice. This case could rekindle a debate around abolishing death penalty in Japan. Interesting. Interesting.
A diagnosis turns the lives of the entire family upside down. Families and research groups observe September's Childhood Cancer Awareness Month.
The objective of the Childhood Cancer Awareness Month is to put a spotlight on the types of cancer that largely affect children, survivorship issues, and importantly, to help raise funds for research and family support.
The cancer types that occur most often in children are very different from the cancer types that occur mainly in adults. Worldwide, more than 275,000 children and adolescents aged 0 to 90 years are estimated to be diagnosed with cancer per year.
Leukemia, brain cancer, and hypohams are the most common types of overall. Young children also develop tumors specific to their young age, such as neuroblastoma and retinoblastoma or kidney tumors. Preventing these cancer types is difficult because the causes are not yet well understood.
In high-income countries where comprehensive services are generally accessible, more than 80% of children with cancer are cured. In low and middle-income countries, less than 30% are cured.
Interesting. All right, joining us. Okay. I think that a lot of times these kind of issues don't need to really be discussed, you know. But let's go to rabies now. This year's theme for the World Rabies Day is breaking rabies boundaries. This theme was chosen to highlight the need for progress and moving beyond status quo. Rabies control programs offer a great example to operationalize One Health, building the structures and trust that are crucial to establish systems for other zoonotic diseases, including those that are pandemic prone.
It calls for innovative strategies and collaboration across various sectors and regions, highlighting the importance of integrating human, animal, and environmental health efforts by breaking boundaries. We can overcome geographic, socio-economic, and educational barriers, ensuring widespread vaccination, awareness, and access to medical care.
This unified approach is crucial in the fight against rabies, fostering a world where the disease is no longer a threat to both humans and animals. The world has the vaccines, medicines, tools, and technologies to break the cycle of one of the oldest diseases. Together in unity, we can eliminate rabies.
This theme highlights the need for cross-sectoral and cross-border collaborations, bringing together governments, health organizations, veterinary services, and communities. In addition, there is a double meaning in the theme, in that rabies itself does not recognize borders or boundaries, and so it is a transboundary disease. The
theme further emphasizes the importance of equality, and strengthening overall health systems by ensuring that One Health is not for a selected few, but rather something that should be available to everyone. And joining us live is Associate Professor of Veterinary Public Health and Preventive Medicine, Faculty of Vet Medicine, Abu Zaria, Grace Sabo Nokia. Hope I just pronounced that name correctly. Please just help me. Did I? Nokia. All right. Thank you very much for joining us.
Thank you very much.
I think this is just a very interesting topic. I think sometimes last week, was it last week or 2 weeks ago? Was it 2 weeks ago? I saw a video on the internet where a boy was actually, on the sick bed, and we heard that it was because as a result of rabies. Right. So, but tell us more. What we need to know about this disease. Say it's the oldest in the world.
Yes. So rabies is a disease that is caused by the rabies virus, and it actually targets the central nervous system and the brain. So generally in Africa and Asia, the vehicle, the means of transmission to humans is the dog. While in the other Western worlds is wild animals, because they have been able to successfully eliminate rabies that is transmitted from the dog to human. But in Africa and Asia, we are still having the dog as the major means of the major transmitter to humans through the bite, generally. But of course,
you know why I had to roll my eyes. I'm trying to, okay, why the difference in animals? Why the difference? One is dog, one is the wild animals. So why? Is it because of the continent? Is it because of the weather? Why the difference? I really want to understand why that difference.
Thank you very much. You see, in the other Western world, they have been able to eliminate through vaccination of dogs and cats against rabies.
All right.
So the humans don't get rabies from dogs and cats because they have taken care of that. It's only the wild animals, and even that they're even working on it because they have oral-based vaccines. But here in Africa, where about 21,000 people die due to dog-transmitted rabies, we still haven't worked on vaccinating our dogs. And if we want to have a herd immunity whereby our dogs whereby we're able to stop this dog-transmitted rabies, we need to vaccinate minimum of 70% of our dogs. Now, in Nigeria, we have approximately 13 million dogs. Approximately. So if we want to have a country whereby we are free of rabies, we need to vaccinate 9 million dogs annually. Yes, for the next 5 years, non-stop, annually. Then we're sure that we'll get to that point. And then after that, all we need to be worried about is any other dog that will come with the rabies infection from another country because of cross-border movement of dogs, you know. Because we have the dog markets, which are really thriving in the country. And so we need to really monitor and regulate the movement of these dogs in and out of our country.
All right. So if our lives are this much endangered, you know, because of dog-cat transmission, or at least specifically dog right now, we know, and how do you think that the government can come in terms of strong regulations? Because I know that even to travel outside, to travel to some countries with your dog, you need a visa for the dog.
That's right.
So, but we have to start with taking care of the dogs in Nigeria first of all, before we start thinking about the ones coming from outside. So how do we start this massive vaccination?
So yeah, the country has actually started mass vaccination 2021. It's just that the vaccines are still not enough. And it's not just about providing the vaccines, it's also providing the logistics so that you make sure that the vaccines are being used. They need, the veterinary doctors need syringes, needles, they need transportation to get to the places that people have dogs. We have, you see, in the urban settings, people can easily take their dogs to the veterinarians for vaccination. But in the rural settings, people don't even have the money to feed sufficiently. Talk more of being able to take their dogs for vaccination, because the vaccines are not cheap. And so we need the government to be able to fund dog vaccination adequately. Presently, the veterinary preventive department, the Department for Preventive Medicine, is under the Ministry of Agric. And the budget, based on what I have, the information that I've gotten, the budget is not sufficient. We're under the Ministry of Agric. Very little comes down to the veterinary
preventive medicine. Yes,
department. And so the prayer is, when the Federal Ministry of Livestock and Animal Health is established indeed and begins to function, then we'll be able to have sufficient fund, hopefully budgeted for zoonotic diseases, that's diseases that are transmissible from animals to humans and vice versa. Then we'll have sufficient money, funding to take care of diseases like rabies.
All right, but while we're getting to this fundings and hoping that it comes, do you think that if truly, the veterinary team drives down to, say, my village, meets a farmer going to hunt with his dog and says we need to vaccinate, do you think he's going to take it really lightly? Like, what's the awareness level so far?
So it depends on where your village is, but but I must tell you that we're working with the grassroots. Like my organization, War Against Rabies Foundation, since 2017 we've been working, and there are other organizations too that are really coming down to the level of the grassroots communities to work with them. In 2017, to be specific, we had the first community engagement with the hunters in Plateau State, because they have this established hunting association, and it was really interesting. We fed them, and they were well, in a very beautiful hall, and then, we talked with them. It was rabies that we went for, but we opened the discussion to cover other zoonoses, because at that time there was outbreak. We were just coming out of Ebola, and then Lassa was ongoing. And so we answered their questions, because my team is a combination of, it's One Health team. So we talked with them, and then in 2019 we had a workshop that was funded by the African Center of Excellence in Neglected Tropical Diseases and Forensic Biotechnology, domicile in Ahmadu Bello University Zaria, funded by the World Bank, and they mandated me to host and organize this biphasic workshop. The first week was for the medics, the veterinarians, and the laboratorians, while the second week was for the hunters and the community health workers, both animal and health. And we had advocacy visit the last day to the community leaders, like the Hakimis, the rural chiefs, and we were able to listen to the hunters and to this, our community leaders speak to us, share with us. Why was it in 2013 I was also asked to organize a workshop and a vaccination, and we only had 600 dogs that were brought, and we know that we have more than that in that little community of Sabon Gari area where ABU is domiciled. And so they told us that they believe that the vaccination of dogs against rabies makes their dogs to be infertile. And they're not able to give birth. And then secondly, the dogs are not able to hunt as much, because a lot of them keep dogs for hunting. You see one person having like 9 dogs for hunting. And so they don't have money to vaccinate, because like in Abuja, vaccination is about, to vaccinate a dog, like 10,000 naira, I think. But in like Kaduna, it could be like 5,000. So it depends on where. And some other places it might even be 3,000.
Okay, so all right. Okay, so I wanted to ask this question.
Yeah.
There's this. Before I come to the meat, there is the people who eat dog. Why are you looking at me like that?
No, you turned and looked at me. You turned and looked at me, so I'm not the one looking at you.
Okay, so the people who eat dogs, there's the people that will eat bush dog.
I was expecting that
question. Okay, so the bush dog eaters, and all the other animals? And all the other animals. But let's just even narrow it down to dogs, because that's what we're talking about. So does this in any way, affect,
predispose
to rabies? Yes. Although I have a doctor back in the stage who will tell me once you cook something, that's gone. Nothing. No. But I just wanted to know. Then, if so, what are the preventive tips that you can give people to guide against that? Then thirdly, just pack this question in one. People who actually nurse these dogs? You know, we've seen on the internet where, you know, dogs just go wild and, you know, attack their owners and sometimes. So what are the preventive tips that you can get? But start from the bush doggo.
Okay, so the danger is in the handling and the slaughtering of dogs, because if the dog is infected, because it's not all dogs are infected with rabies. It's when they are also exposed to another animal that has rabies that they also get infected. So our dogs are, I mean, don't be afraid of dogs. Keep dogs, keep pets, because we need them, you know. And they're also asking us to take care of them so they don't get rabies. They don't want to have the rabies because they don't want to bite their owners or other people. Yeah. So the rabies virus is located in by the time the person is the dog is bitten, the virus moves to the central nervous system, right to the brain. So after multiplying, it takes over the brain, and then, well, to cut the long story short, it gets to saliva, right? So we have it lodged in the nervous systems, right? So during the time of slaughtering, if peradventure there's a splash of any of the nervous tissue that is infected, carrying the rabies virus, and it splashes into your mucous membranes of the eyes, the person gets exposed to rabies, right? And then if he has cuts on the hand, or she, and it gets into the cuts. And that's why we say don't allow dogs to lick your wounds, because if it's a rabid dog, you can get infected, not just bite. So any opening in the skin. And so for those people that eat dogs, if it's cooked, they're safe. I'm not saying eat dog. Okay. Please, I'm not saying eat dog, but because you see the rabies virus, even though it's very dangerous, it's very, very easy to destroy. Just a temperature of 56 degrees destroys the rabies virus. It's an RNA virus. It's very easy to denature. So, and you know, we cook here, we cook up to 100 degrees Celsius. So for cooking, eating cooked, it's safe. So, but for those that like take the brain tissue, maybe in concoctions, because I've seen people that come to buy the brain just to make some herbal concoctions for one thing or the other. Peradventure you have like a little wound in your mouth, and the virus lodges there. It goes, multiplies, moves to the brain, and you know, the person can become rabid. So it's safer to stay away from such practices. The second question was...
Okay, so no, I was just saying that, look at the tips that you give to people. Yeah, the tips that you give to people. Preventive tips that you give to people.
So when a person is bitten, or when a person thinks he's exposed to any rabid animal, first of all, if it's a dog bite, if it's a bite, a scratch, wash the wound with plenty, or the scratch with plenty soap, plenty water and soap for like 5 to 15 minutes. Right? And then you immediately seek the doctor's help. Go to a hospital. The doctor will communicate with the veterinarian so that there is the animal investigation to find out if the animal is rabid. Meanwhile, the person will be vaccinated, and based on the investigation done, they will determine if the person will not take one dose or the full dose. Because the full dose is from that first day of exposure, so we call it day 0, then you go to day 3, day 7, day 14, and 21 or 28. So there needs to be complete administration of that vaccine, so that you don't go back and say, but I got vaccinated, but I'm still having I'm coming down with rabies. You need to complete the vaccine.
All right. So and then I'm wondering, you know, there are a lot of stray pets, stray dogs rather, and other pets out there unaccounted for, and who is going to take them to vaccination? So what do we start doing as a country that is serious about combating rabies, especially to human transmission level?
Yeah, so, you know, I talked about provision of vaccines and the logistics, because the veterinarians and the animal health workers, which we train, the vets train in different schools, are also knowledgeable on how to capture roaming dogs. In Nigeria, we don't have stray dogs. If you see any dog straying, it's mad. We call them roaming dogs because by the time you investigate, you find out that it has owner, and there's an owner there. It's owned roaming dog. It's not a stray dog. All right, but a rabies dog, because it can travel from here to Mararaba. Because it's mad, it's lost its direction. So then it's stray. But generally, we have what we call owned roaming dogs. So we capture, during our vaccination, we capture roaming dogs and vaccinate them. There's also the option of the oral date vaccines, because some of them are difficult to capture, even though we have equipment that we can use to capture them, because they're really difficult to capture from experience. So if the Department of Veterinary Public Health has sufficient funding, this can be looked into. And because of that, so many international NGOs are working. We're all working. I belong to the National Technical Working Group for Rabies for the nation. And we're coming together. We're really working under the One Health platform to see how we can get grants aside disturbing our government to do what is right, what is the responsibility of the nation to do, because we can't just only be dependent on the Western world. Yeah. I mean, we need to, own our responsibilities and handle it well. Okay,
there's this question that's coming to my head. I don't know if I should ask it, but
if I have the answer, I'll give it. If I don't, I'll say I don't know.
But the question is just coming to my head.
Please go ahead.
But I'll start asking the question. Okay, so the question is, we know you've seen people who use pets, majorly dog, for, sex you get, and it baffles the mind. Do people, those kind of people, what happens, can they contact, the rabies, Jonathan? And secondly, is there a cure for rabies?
Oh, thank you very much. So I'm sure those kind of people, if they can go to that level, it means that they are really taking care of those dogs. Yes, those people will not, because they will know that there is rabies. And so you find those kind of people take care of their dog more than even their mother or father. I'm serious. People spend money on dogs. Those people that are into that. I've seen some of them, but not in Nigeria, outside the country. So then you said, how is there a cure? Yeah. So the very terrible thing about rabies is that once the symptoms appear, death is inevitable. Yeah, so it's almost 100% fatal. But the good news is the fact that we have the prevention. We have the vaccines. Once a person is exposed, you just go get vaccinated and you're complete the dosage. 5 in this country, we're still using the 5 dosage. 5 doses. Complete it and you're good. So please, when you see the signs, if you're exposed and you begin to, don't wait for the signs to manifest. First, okay. Because once they manifest, you're gone. I mean, the person is gone. Yes. Interesting. Signs, and the funny thing is that the signs are very similar to the fever, flu, flu, okay. Fever, sore throat, delirium, confusion, hallucination, okay. And so many times in the hospital they get misdiagnosed for something else, like a cerebral, maybe meningitis. Oh. Yes, and meanwhile, by the time they get to know it's rabies, it's just too late.
Thank you very much. What an interesting discussion to have with you this morning.
Thank you.
Thank you. We'll go on a break. While we'll come back, we'll still have more for you on Live from Abuja. Don't go anywhere, we'll be right back.
Advocate and a published author.